Industrial action by GPs in England about funding could begin today. The result of a ballot by the BMA will be announced later that could see doctors limiting the number of patient appointments and stopping work if they're not formally contracted to do.
Doctors' Union says some practices are having to close because government funding has not kept up with rising costs. Let's take you through some of the details. If GPs vote in favour of the ballot held by the British Medical Association, they will work to rule and hold a maximum of 25 patient consultations per day. Many doctors do closer to 40 on most days.
Now, other services like fit notes and prescriptions will be limited. This comes as government ministers announce plans to slash red tape to enable GP surgeries in England to hire more doctors. Let's talk more about this. We're joined now by GP, Dr. Mohit Mandiratta. Good morning.
Good morning
to you. OK, sure. Just for a sense of disclosure and clarity, where are you on this?
So there was obviously a referendum done earlier in the year about the new contract that's been proposed. 99% of doctors rejected that proposal. I was one of them, and there's obviously been a ballot now. The results haven't been revealed. They're going to be revealed today, and I voted for action. Now, I think it's important to clarify this. It's not strike action. We are still working, but as you've mentioned, it's working to contract. General practice picks up so much work that's not funded to do, not contracted to do, so it's getting back to what we're contracted to do is what we're sort of proposing. And the other aspect is the BMA has said it's up to practice exactly what they do. So they've put suggestions forward in terms of how many patients you see, referral pathways, data sharing, lots of different things, but it is up to individual practices exactly how they implement that change if they wish to.
How long will you be working to contract?
Again, that's up to practices. So they've not mandated anything. They've suggested that practices make the changes that they think will be most appropriate to still provide care. So, again, it's really important to say general practice isn't closing down. We will still be open. You will still be able to access your GP. You will still be able to use 111, access urgent treatment centres.
So I just want to be clear. So this is an unlimited amount of time?
As it stands, because obviously conversations are still ongoing with the government about a new contract that reflects the funding we need in general practice a little bit better. The contract we've been offered is actually a year-on-year pay cut. You know, if we look at how much general practice is being proposed to be paid, it's £107 per patient for the year for unlimited amounts of contacts. That's 30 pence a day. You look at a lot of other services, that's tiny amounts of money for the complex care we provide. And, you know, as a GP, I came into general practice 10 years ago. It's totally different now to how it was. I want to go back to what I do best in terms of managing uncertainty, managing medical complexity, providing continuity of care. At the moment, we all feel like we're firefighting. We're only dealing with the acute, urgent things that come through because demand so far outweighs capacity.
We're very glad you've come to talk to us here on the sofa, and you've been very straightforward about what you think and how you voted. We await the result of the ballot. It's all important to say. But if it's the case that instead of seeing 40 people a day, one GP is seeing 25, of a service which is already on its knees and people complain all the time, it's not necessarily your fault, but they complain all the time, they cannot get an appointment, and then there's 15 less a day for each GP, this sounds like it could have a devastating impact very, very quickly.
I think it reflects how much work general practice does. So that figure of 25 is a safe figure that's thought that clinicians should do every single day. A Monday for me, when I'm duty doctor or on-call doctor, I will see 45-plus patients or have 45-plus patient contacts, do hundreds of prescriptions. I'll be supervising 2 or 3 people. I'll be dealing with clinical letters. That is not a safe level of work. The workforce morale is so low right now. General practice is burnt out. You know, we've had manifesto promises of thousands of more GPs. We're actually 1,700 GPs down over the last 10 years. 1,300 practices have closed. So I completely agree with you, but I think general practice, something has to change. General practice is on its knees.
I absolutely take the point you're making, which is the welfare of GPs and the workload you face and the stresses that puts on you. But I'm trying to get you to address the other side of the coin, is that on those days when you would have been doing 45, which I think many people would agree is too much, the fact is that 15 or 20 people don't get to see you.
I think
on those days that you or your practice chooses to do that, that's immediate. The next day, there'll be more people because they didn't get appointments the previous day. That builds up very quickly.
Absolutely, and I think that's why it's up to practice exactly how they implement this. But I think, again, the important thing for me here is we share patients' frustrations in that I completely understand that GP access is far from perfect. The side issue to this is it hasn't been perfect for years. Funding hasn't kept up with exactly what we need for years and years and years. So
the government says it's bringing in 1,000 newly qualified GPs this year. That's help, isn't it? You said you were 1,700 down over the last 10. That's good, isn't it?
Yes, but again, it goes back to sort of investment. You know, at the moment, if you look at our practice, for example, we have nowhere to put new staff. So we'd love to get new staff if we had enough funding for it, but we don't have space. You know, GP estates haven't been invested in for years. We are small businesses, so we are contracted to provide, obviously, general practice and primary care. But
so you need more buildings as well?
Partly need more building space. Yeah, most practices I know in my area are bursting at the seams. So where do we put these new GPs? Again, there are GPs that I've trained locally who are struggling to find jobs because practices cannot afford to employ them at the moment. And again, the whole system just isn't working at the moment. We absolutely need more GPs. Yes, we have a lot of wonderful allied health staff, paramedics, physicians associates, pharmacists, etc., who support what we do, but exactly what we do is what we need. So general practice and GPs need more GPs to provide that complexity of care. So the other staff are brilliant at supporting what we do, but we really need a plan for retention and recruitment. Again, we teach medical students at our practice. People don't want to be GPs anymore because of what they hear about the profession, because of the burnout. You know, I know doctors who've moved to New Zealand, moved to Canada, so something really needs to change.
We'll be hearing an announcement later this morning from the BMA. We will find out what happens there. Dr. Mandiratta, Mohit, thank you very much for your time with us.
Thank you.